If I might direct a question to you, what has been the experience? You talk about there have been cases among children in Rhode Island of coronavirus. What has been the experience here in Rhode Island among pediatric cases?
We have had relatively few cases among children. For those less than 10 years of age, we have had 2% of the cases, and those less than 20 years of age, total of 4% of cases. So thankfully, we have done well here, as is the case in other states, and we have an excellent pediatric provider community that's ready to respond further.
Is that in line with the experience in other states?
Yes.
Dr. Alexander-Scott, today's testing numbers were quite high, close to 3,700, but the positive rate was quite low, 181. I think that's about 5%. I know in the past you've said those numbers are sometimes correlated to the specific groups you're testing. Is that the case today?
It continues to be that. What you shared is the goal we want to work towards. Make sure we have expanded testing and are testing enough people to capture the fact that fewer and fewer people are infected. The only way we can do that effectively is to make sure that we continue to target the communities that we know are most impacted. And we make sure that we pull apart that data and really analyze it to understand by zip code, by community, and still working on, as you had suggested previously, by testing site to make sure that we have the resources for every community from every zip code to respond.
Doctor, you accomplished quite a feat when you announced on Monday that every resident and every staff member of every congregate care facility nursing home had been tested and would be on a cyclical testing cycle, cyclical testing run. And I'm curious about the congregate care facilities that are essentially the two prisons in Rhode Island, the ACI and the Wyatt. And my understanding, I believe, is that there's been no cases of prisoners who tested positive for COVID at the ACI, correct me if I'm wrong, but the reports that the Wyatt is filing with the federal court under order indicate what looks to be, or what appears to be, the beginning of an exponential curve with positive tests into double digits. And the Wyatt, from their report, appears to be testing, about 20 people a week, 20 detainees a week. And what is the Department of Health doing in support of that testing effort? Are you doing anything comparable to what you've done with nursing homes, send in mobile teams, testing facilities, and so on? Or are you in a more supporting role to the medical staff there?
While the federal government is the primary responsibility or responsible organization for the response at Wyatt, as I've shared before, our state epidemiologist and our team has been in very close contact with the medical director there, because we want to make sure that any outbreak setting in our state has the response to keep it under control that's needed. Based on that, we have engaged with them, pulled in the resources of our congregate setting support team to make sure that they have the education they need to enforce the infection control policies that are going to be necessary to keep their outbreak response under control.
Is the Department of Health supplying tests to Wyatt?
We are working in coordination with them. They are the sole accountable entity to do it, and we want to make sure that we fill in any gaps and help push them in the direction that's needed to go.
Doctor, can you please discuss a little bit more this Kawasaki-like syndrome, what it is exactly, and what it is exactly, and what the fear is, and then response by Hasbro Children's?
Yes. In advance of doing that, I wanted to answer the element of your question that was also included. We have, not only with nursing homes, but with congregate settings, activated our comprehensive, proactive surveillance program across the board, as I have shared. As a result of that, within the last 24 hours, we've learned, based on our proactive testing activities for the congregate setting of the ACI, we have identified a small portion of inmates who do not have symptoms but have a positive test. We're working very closely with the ACI regarding those cases. They are isolated appropriately, and all of this has been part of our proactive response with all of our congregate settings and what we intend to do going forward across the state as a part of our expanded testing strategy.
How many small?
Less than about 5 or so. And we're still collecting the data, so we'll be updating that. In terms of the multi-system inflammatory syndrome, we are learning each day as it occurs. Kawasaki disease is an analogous but distinct inflammatory disease that we are all still learning about, even though it's decades old, and really responds to an inflammatory reaction to some form of inciting element, such as a virus or other entities that can occur. Symptoms connected to that include a fever that may not go away, abdominal pain, diarrhea or vomiting, a rash, which many people are seeing in the pictures, trouble breathing, or a child who is sleepy or has other elements. Our very close relationship with the provider community, particularly Hasbro Children's Hospital in this scenario, really demonstrates for us that we are fortunate in Rhode Island. We have engaged, active, brilliant providers who care about the patients, have already reached out with a proactive plan of engagement, and are going to be joining our group discussion today with infectious disease docs and critical care doctors to make sure across the state everyone is on board with our plan for going forward.
Dr. Alexander-Scott, if you could just provide an update, is there any indication that case numbers are decreasing at nursing homes, or any indication that the steps that you've taken there, whether it be the National Guard or increased testing, are having a positive result, or is that flat or worsening, or what's the situation?
As we're continuing to assess that, it's going to be a balance in definitively saying, because of how proactively we are working to get testing done and to continue to identify people who may have COVID-19 exposure and a positive test with or without symptoms. The more testing we do, the more we will identify, the more we will also be able to respond. So over time, we will start to see the benefits of this. We are absolutely convinced that this aggressive, comprehensive approach is the way to go, making sure that nursing homes, congregate settings has the PPE they need, the infection control guidance that they need, the testing, ability to cohort in the way that they need to. It is a massive undertaking. It is our top priority, and I'll continue to keep you posted as we go with showing the benefits that we are sure will come over time.
Has there been any sign of improvement so far?
There has been, in that we've been able to provide nursing homes and congregate settings the support that they need, knowing that there's still more to go. When you see that the PPE is in place, when we make sure that the infection control guidance is offered and being followed, when we know that we are, we've completed the first round of testing and we want to circle back and continue more, those process measures are definitely what we need in place to be able to say that over time we will see the outcome improvements we are determined to get.
But not in terms of case numbers, you can't say.
Correct, because it's challenging to see, because we're continuing to identify more and more, which is the goal in our approach.
Doctor, yesterday's report from the Rhode Island Department of Corrections said there were no sentenced inmates with COVID-19, and now you're saying that's closer to 5?
Within the last 24 hours, based on our proactive surveillance. And I'll be updating on the actual numbers. We're still collecting that data. Yes.
Sentenced inmates, not people held as commitments, like people have come in and segregated these people in the population?
Well, yes, and we're still confirming as we'll make that clear going forward.
Okay, thank you.
Governor, I have a question about the summer sports camps. Why not leave it up to the players, their parents, the coaches about the summer sports camps? And I want to be specific.
Yeah.
There's a young man, now I attended Bishop Hendricken. There's a young man, he's a junior. He just got a full scholarship to play football for Notre Dame, which, as you know, is unprecedented in Rhode Island. The reason he got that is last summer at URI football camp, Michigan, other colleges saw him. Now, at these camps, and that is his ticket. If you take that away, that's a chance. They test speed, agility. They want to interview the young man or boy or girl. But why not leave it up to them to set up a safe atmosphere for these summer camps?
That's exactly what I'm doing. Like, that's a perfect example of a program that I hope will continue. I mean, that's not up to me. There's going to be a lot of, like you saw this morning, that they decided Camp Yagu is not going to have the overnight camp this year. I respect that decision. You know, what I'm saying is starting June 29th, you can, as long as you follow these health and safety guidelines. And I hope that most will. That's exactly why I'm doing it, because I think sports are really important. A lot of kids get a lot out of these summer camps. So I'm hoping that more often than not, all those providers will say, yes, we're going to provide the camp, we're just going to follow the new rules.
Just to follow up on yesterday, I received a lot of email about, and you mentioned possibly with hair salons, that workers might be tested. Any other thought on that, or if they set up an atmosphere where their clients have to be tested or they would be tested?
So what we're trying to do, I'm trying to set up a system where we enable business safely, but also that builds confidence. I'm very aware of the fact that a lot of people are afraid. Even though you can get your hair cut or go out to a restaurant, a lot of people in Rhode Island are saying, I don't want to, I don't feel. And that's not good for the economy. I actually want, when we say it's okay to get your hair cut, I want you to all go out and get your hair cut. So I'm trying to figure out how do we create an environment where you feel confident to do that. And some of that will be testing. Now, I don't know if we have the capacity to do every hairdresser or barber, or if we even need to, but the thought is having a pinpointed testing program for these close in contact business owners, I think will build confidence to the client that I know my hairdresser's been tested, was tested negative, I'm going to go get my hair cut. So I don't have the answer today. We're talking to hairdressers and barbers and small businesses and restaurant owners every single day. We're trying to get from them, what do you think you need? What do you think your customers need to hear in order to feel confident? And if they come back and say, we want to be tested on some regular basis, then I want to try to figure out a way to do that.
Have you heard a lot of Rhode Islanders don't want to go dining before they can go to the hairstylist?
I think we all have overgrown hair right now, so we should just go for it. Wear your mask, no one will know who you are.
No judgment dining.
No, exactly, no judgment.
Everybody looks great, and everyone's lost weight.
Fabulous, exactly.
Governor, back on the summer camp. Is the expectation that kids would have to wear masks at summer camp, even sports camps yet, or?
Yeah, we're still figuring it out. I think not, but we're still figuring it out.
And then just if you could, I know a lot of parents have probably already paid for a lot of either spring or summer sports programs that are now, again, in limbo or canceled. Will the state have any guidance on what should happen in terms of the money?
Those are all private businesses, all governed by their own private arrangements and contracts. So my job is to provide guidelines around how you can safely operate the camps. I hope they do it, and if they don't, then it's up to them to figure that out.
Governor, when it comes to the camps, grouping children in smaller groups often means more staff. Are you going to help them get more funds so they can hire?
Exactly. So that was the point I made about using the COVID Emergency Relief Fund. So already we've been hearing from mayors and town leaders saying, you know, okay, we want to do this. We want to make sure there's an opportunity for our children. It's more expensive. It's more staff. It's more cleaning supplies. So we are aware of that, and I plan to use some of the stimulus funds to help them do that.
Governor, you mentioned learning during the summer. Any specific plans at this point for whether summer school will happen and whether that will be digital or potentially in person?
Summer school will happen because there are kids who need to either make up a class or have special needs. It will most likely be primarily virtual, but not exclusively, and we're working on it right now. But for anyone who knows they have to make up schoolwork, you will be able to. We're going to make it possible.
Thought nobody was going to flunk.
No, I never said that.
Oh, okay.
All right, thank you.
Thank you, everyone.